We won't get into the debate.
Oh, that's
of all
really,
of this,
that's going to be, I don't know.
That's controversial, which is fine for this one. Welcome to The Collective Mic, the podcast where women leaders get loud about what really matters. I'm your host, Joyce Tody, founder of Collective Women's Leadership. We are not here for fluff. We're here to lead, build, and rise together. Whether you're climbing the corporate ladder, building your own brand, or redefining leadership on your terms, this mic is for you. So let's get into it. Welcome back to The Collective Mic. My name is Joyce Tody, and I sit down with really powerful women within our community who are changing lives, redefining leadership, business, and their impact. And today's conversation, I'm so excited, is such an important one because we're talking about something that touches every single family and every mother, and really the future of how care for the next generation is going to go. So I'm joined by Dr. Suzanne Al-Hamad, the founder of Wildflower Pediatrics, also a proud member of CWL, who's rethinking what pediatric care should actually look like, more personalized, more intentional, and deeply rooted in connection. So with that, Dr. Suzanne, I am so excited you're here today.
Thank you so much for having me. It's been a wonderful community to be a part of. I've been busy this winter, but I look forward to this spring season, being able to be more present in the community. And I want you to know, like, when I started my practice, and I was looking for community out there of women, yours is one of the first ones I found. And I tell people, like, I love running my practice. I love what I do as a physician, but something that I really love is the community of women that I've met, and CWL has really been an integral part of that.
Oh, wow. Thank you so much.
Yeah.
Thank you.
Yeah, you're welcome.
We try. So what I love is, walk us through your story, your education, what you were doing prior to Wildflower, because you are really redefining this. So I would love to hear, like, your bold story of getting to where you are today.
Sure. Okay. So I guess I'll start from inception. I went to college. I went to medical school. I went to residency at Johns Hopkins. I did a residency in general pediatrics. From there, I went to University of Maryland and I did a fellowship in neonatology. So that's newborn ICU.
Wow.
My husband's also a physician. He's a pediatric ER doctor. We finished training around similar times, and then we were looking for our next steps in life, and we had family out in Las Vegas, and we love the outdoors, so we relocated from the East Coast to the West Coast, and we haven't looked back. We love it. Yeah. There's so much that we love about Las Vegas. But
it's a nice place to be. That's a whole different podcast, right? It's sunny like 360 days a year.
Yeah, and that matters a lot. Yeah, we say we can live all year instead of just part of the year.
Right.
And so I came to Las Vegas and I worked full time as a neonatologist in the newborn ICU for my first 3 years here. And while I was there were several things. There was a journey I went through both personally and professionally where I felt like my skill set could be better served in a different way. And I saw a huge need for improved newborn care, pediatric care in general, but also care for our most vulnerable populations, such as children that had been in the NICU or with more complex health conditions, or families that just want better care and don't know where to get it.
Right.
And so I, once the idea started, I couldn't stop.
Right.
So it popped into my head, and then I couldn't shake it, and I eventually, quit my job and was like, I'm going to do this.
Good for you. I love that. Talk about a bold move. I mean, quitting your job and then starting something brand new is not for the faint of heart.
No. And luckily, my husband was a great support in that, and so encouraging. He saw what I was imagining and was like, you can do this. And that's so helpful to have.
Sure, of course. Yes.
And so God bless him for that. So I took about a year to plan my practice, really set up what I thought would be most valuable to families, and then open my doors. And as I suspected, the need was certainly there.
Huge need, right?
Absolutely.
Did you see something missing for families that you knew that you could definitely do differently?
Yes.
Yeah.
I'm a pediatrician. My husband's a pediatrician. Right. And still, when our children have health needs, I'm like, how do people navigate this world, this system? And so I knew if it was challenging for me, it was
Who's in the field?
That it must be impossible for those other families. I also saw like these babies that we were discharging from the NICU. I could only imagine how many questions they had once they left those doors. And I knew that pediatricians in the community, especially in Las Vegas, where the pediatrician to patient ratio was one of the worst in the country, meaning pediatricians had to see so many patients.
How many do they have to see? Do you know?
So a typical pediatrician panel is probably around one pediatrician for 3,000 patients.
Oh my gosh.
And so that leads to, a pediatrician will see 30 patients a day.
Wow.
And they'll see, each patient has about 15 minutes.
Right, that's it. Yeah, you're very in and out.
In and out. And you've been waiting in that waiting room for a while. So if
over an hour.
Taken off work, you get in there and you're like, that didn't even really solve my problem. Maybe you're not going to go back. Right. And then you take to the internet or whatever alternative source for your health information. And then you get a lot more and more lost from there.
Yeah.
That was the gap that I was looking to fill. I became a certified breastfeeding specialist. And so I decided that fourth trimester, the first 2 months after a baby goes home from the NICU or delivers, I'll go do home visits.
Okay.
And I'll also do breastfeeding support in the home. And I would have families have direct access to me. Mm-hmm. And so from the get-go, it's clear to families that their problems are being solved in a faster manner.
Very quick, yeah.
I noticed that families oftentimes, when they first join my practice, they're a little bit anxious. They don't know is this real? Are you really going to help me? Are you available to me? And so there's this period of settling into the practice and understanding that we are on the same team and I am there to help you and I am accessible.
Right.
And the relationship kind of just blossoms from there.
So what would you say right now parents struggle with the most in terms of pediatric care and navigating the healthcare for their children, right? So you named some of them. So it's just the sheer time of taking off work and sitting in a pediatric office for hours to be seen for 15 minutes and half of your day is done. So you almost have to take a sick day as a parent to take care of your child. What else have you seen that parents really struggle with in that regard?
Yep. One is there's a fear component. A lot of families have had bad experiences in the healthcare system, and so there is a lack of trust in the healthcare system in general. And so then when they go to their doctor after they do the long wait and then they have the 15 minutes, they're told to do something, but the trust isn't there.
Yeah.
And so they don't follow through.
Yeah.
Or they want to follow through, but they didn't fully understand what they were being told.
Sure.
A lot of people, it takes several
repetitive.
Yeah, you need to repeat yourself several times. You need to go home and try to integrate that advice into your lifestyle and see how it is or isn't working, and then ask follow-up questions. Well, this isn't working like this. Is this a good option?
Sure.
To really find a true solution.
Yeah.
And so I think once families go and do that 15-minute visit, they don't get a true solution, then sometimes they just give up.
Right.
And that trusting relationship is one of the biggest issues.
And most of the time, the solution is prescription. That is so quick to just come off the pad.
And that's so families feel, okay, if we go, say I go to discuss my child's behavioral concerns with my doctor, are they just going to label them ADHD and write a prescription? I don't want that.
Right.
So I'm not going to go seek that help.
Well, and in 15 minutes, how can you diagnose that?
You can't.
That's not a diagnosable. I'm not even a doctor, but I think we all know and have come to the realization the over-prescribed generation that has happened. I think I would say it started in the 2000s, early 2000s.
Yep.
You're the medical expert.
Yeah, I mean,
in that regard,
I would say a lot of I think we've come to understand that more, and I think more and more physicians are understanding that there was overprescription. But I think that probably over the last 20 to 30 years, like a lot of the recent college grads, that age of people, I think that they kind of were at the crux of that.
Right, that's right. Yeah, my son is 21, and I just remember, I mean, we would have the 15-minute visits. There would be a prescription written for an antibiotic. And luckily, he's a very, very healthy child, and I'm so lucky and blessed for that. But I can't imagine if there was another issue that we had to chase. Right?
Yeah, right. I mean, that's
hard.
A true,
no way.
Right? It's
hard.
Nothing else matters more than your health and the health of your children when it comes down to it. No matter how fortunate you are, how great your life is, as soon as your health or your children's health goes out the window, nothing else matters. People will sell their legs.
Yeah, of course.
To help their children.
What do most people not understand or realize about how the current system is structured? So I think if you could just very quickly run us through that, a high level structure of why it's so frustrating and why you're so accessible and in a business like yours. And we're seeing more and more doctors pop up who are really wanting to provide, there are some in CWL. We have concierge medicine, right? But I think that concierge medicine has a connotation that it's very expensive and not accessible. And it's becoming more accessible than ever now. So just walk me through that.
So the way that it typically works is, you have large practices of pediatricians and you need to see several patients. Every physician needs to see a pretty high number of patients a day to be able to cover their overhead, because reimbursement from insurance companies is going down and down. And there's the overhead of hiring staff, ordering medications, supplies, and those prices are going up and up. Right. And so even in Las Vegas, more so than other places, there's more private practices.
Right.
And I think that that's just something that's unique to Vegas right now, but may change with time. As more practices are bought out by larger organizations.
Right.
And with that, you streamline more, make it more efficient. So increase patient numbers that are being seen, decrease costs and support.
Sure.
And so with that, very well-intentioned doctors and nurses go into that field, go to do their best work, and get burned out with time.
Yeah, they can't continue.
They can't continue, or they do because they have student loans. They have family to pay for. And so they continue on, but they succeed and say, I'm going to keep them alive. I'm going to make sure that they stay safe.
Right.
But that's not necessarily optimizing health. And I truly believe it's at no fault to the people that are in that system.
Right. No, not at all.
When I left my prior employed position, people just say, "How are you so brave?" Like it seems
that's
so
what I love.
Scary.
Yeah.
But once you see how you can do it, you say, "How can you stay?"
How can you stay? Yeah.
But so basically, physicians need to see that many patients so that they can
pay the bills.
Pediatricians don't get paid a lot.
Right.
They're the lowest paid physicians of any specialty. And that's because insurance reimbursements are the lowest for children.
Okay.
So how my practice is different.
That's a great segue. My next question, let's talk about Wildflower Pediatrics, because I really want to know what makes your model different.
Yeah. So it's very simple. It's so simple. I don't contract with insurance.
Great.
I charge a monthly membership fee. It's paid on a month-by-month basis. And I use insurance for the big things. So vaccines, I run those through insurance through a separate pharmacy. Labs,
Sure.
So say I send someone a LabCorp request, insurance is used for that. Or if I do a swab in my office and send it out, insurance is used. And then imaging. So when you go to an imaging center, you just use your insurance, and it's used to the more expensive things. Or of course, like a medication at the pharmacy, insurance is used for that.
Yeah.
But the thing is, there's alternatives. There's cash alternatives for that. I tell families, I always still encourage them to have a high deductible catastrophic plan of insurance in case something terrible happens.
Yeah, of course.
Some families don't have that luxury. Yeah. They can't.
Right.
But they're still seeking some sort of medical care. And so this is an option for them as well. I don't require you to have insurance, but the majority of my families do have some sort of insurance. And so that monthly membership covers all cost of care. There's no additional fees.
There's no surprises.
No surprises, predictable payment. And if something happens, it's not working, you're moving, whatever, you let me know, and it's done at the completion of the month. So it's no obligation. There's really no risk. And my families stay because it's a mutually, they're receiving excellent care, and I'm giving excellent care. Yeah. They're not staying because their hands are tied and they have no other option.
Of course. No, that's a great model. How would you describe the experience a family has when they walk into your practice?
So most families, I meet them at the door.
Great.
I have a waiting room, but the couch is rarely sat on. It's very pristine. And then they come into my office. I usually have music playing.
And they're like, "You're the doctor?"
Yeah.
You're so young. When did you graduate? Like last year?
They used to say that. They used to say that. They stopped saying it.
Oh, damn. I hate when that happens.
I know. I was like,
you stopped saying it this year.
I said that. I was talking to someone recently, and I was like, they stopped saying it, which is good because like I just feel like I have that experience now, and that feels so good to be like in the stride of my career, but at the same time, it's sad. But yeah, so they come into my office. Every patient has an hour long visit. Wow. And it's a face-to-face conversation. Oftentimes the first visit, we need more than an hour.
Right.
And I do frequent follow-ups from there until we really get problems solved.
Sure.
I find that especially when patients or children come with more complex issues, that first 6 months is a lot of frequent care. And then after that, it really settles out because problems start to get solved. And there's a level of trust there that families haven't experienced before.
And you're able to obviously, refer out to specialists above your, above what you're practicing.
Exactly.
Like have the relationships in town for the best.
I spend a lot of time cultivating those relationships. Another part of like when I say like with CWL I've joined like one of my friends, she's in this space and she created like a medical practice networking group. And so we have like a text thread where we ask each other questions. I've found the specialists that are most similar to my philosophy that have the time or capacity, energy to provide excellent care and refer my patients to them.
Yeah, very smart. And that relationship you constantly are cultivating is so important because you're referring out to a family that knows the level of your care, and you want that to be reciprocated to
it's a reflection on me.
Right.
It's absolutely a reflection on me, and so it's just as important to me as my care when I send a family somewhere else.
Sure.
And so like once a week I'm meeting with someone, having a conversation, seeing what kind of care do they provide.
It's almost like, and correct me if I'm wrong, but you creating something as a founder, becoming this really incredibly important space, it's almost as if it's why you became a doctor to start with.
Yeah.
I have to believe that those who become a doctor of any sort of practice want to help and want to help in the most effective, intentional way. And unfortunately, based on the system, you could be a really great doctor, but you're stuck in this system that is so broken that you lose sight of why you became a doctor in the first place and invested hundreds of thousands of dollars and hundreds of thousands of hours to be a specialist. And I really commend you for breaking out and saying, I became a doctor because I wanted to help. And I specialized in pediatrics because specifically I wanted to help children. And what does intentional care mean to you as you're practicing?
When I go to that, first of all, before babies are even born, I do a prenatal consult. So when a mother is expecting, it's usually a FaceTime call, like a video call. I talk to them about, I get to know their family.
Because they're handed over to you after they leave the hospital.
Exactly.
Right, yeah.
So before they even give birth, I like to know my families.
Right.
Say, what's your plan for birth? What are your thoughts about this? Do you understand why this happens or why that happens? And I educate them on those things before they even go to give birth. That in itself, it's shocking to me, like how useful it is.
Of course, especially for a first-time mother.
It's the fact that it doesn't happen, like it's such a low-hanging fruit. It's so easy to make a huge difference.
Yeah, of course.
When families first get home, those first couple of days, they text me. They have worries. Instead of going to the emergency room for something unnecessary, being exposed to illness, I can reassure or give them help intervene. Yeah. When I come to their house and do that first home visit, I sit down on their couch or sit in their backyard. I meet their family. I see their home environment. I see what they're... I understand that every person is different. People have different desires, goals, perspectives. And I respect those. And offer medical advice, evidence-based medical advice within those contexts. And provide education without judgment.
So important. How do you balance your medical excellence with emotional connection for both the child and parent? Because I would have to think, because you're so genuine and passionate, but yet you have this medical expertise. How do you balance that as a physician?
I've had to do a lot of mindset work.
Yeah, I'm sure. That would be hard, right?
Always like, it's a mindset shift. It's a mindset shift. And so understanding that setting boundaries are intended to preserve relationships and preserve my energy so I can continue doing what I do.
Keep doing it,
Yeah. And that was something that I certainly struggled with at the beginning and have put a lot of work into. And as I was told and as I progressed, I see that the more you do it, the easier it becomes.
You also come from the NICU too. I mean, God bless those nurses, because I think that's probably one of the hardest things.
They're the best nurses in the hospital. Actually, like one of the nurses that I work with, she helps me in my practice. And that's been one of the biggest assets in the last couple of months, because those NICU nurses are the best nurses in the hospital. I'm used to dealing with high emotions.
Right, of course.
And being there when families are having their worst day.
Yeah, right.
So I've had a lot of experience with that, and I've realized just being present and listening is usually step one.
Well, now you're a leader, and now you're a business owner and a physician, right? And a mother. I mean, you balance so well.
I have 2 children.
You have 2 children,
of your own. It's a constant balancing act, as you know.
Yes, of course. Stepping into ownership. So what does that journey look like for you as a woman building a business in medicine? Because that's not been the norm, right? I feel like those who have stepped out in medicine and built their own practice, it's typically male first, male forward in that regard. I don't know if it's still male dominated, but doing that in a space that I'm not sure you have much competition yet in Vegas. So what has it been like in terms of now becoming, I talked a lot about this with my guests and friends who come from professions such as being an attorney, a doctor, a dentist, all of those types of things. You're not taught anything about business in medical school, not one thing. And that is such a disservice, because it doesn't even allow you. It doesn't even allow you to get out on your own.
That's purposeful.
To keep you in the system. Fascinating. That's
and
fascinating.
To disempower you. Put you in golden handcuffs.
That's fascinating.
It's purposeful. So I'll tell you, when I would get so frustrated, because when I first left my job, I would have different people comment like, "Oh, it's almost like they thought I was doing it so that I could take a step back. And people were like, oh, like, are you just taking a step back?
Are you burned
while your
out?
Kids burned out.
Oh, you're a mom now.
You're a mom now.
Oh, so ridiculous.
And I would get so frustrated.
Of course.
Because I was like, no, I'm not. I'm trying to do something
different
to help. I'm not quiet quitting.
No, I'm not quiet quitting.
I'm not quiet quitting.
I'm doing what I signed up to do as a doctor to begin with.
Yeah,
But isn't it fascinating that women get this stigma? Mm-hmm. It doesn't matter, and it's not agnostic to any profession. Mm-hmm. If we're shifting or changing or becoming bolder or louder or changing and taking risks, we're burned out. What's wrong with you? Right? Are you okay? Like people, and I do find, I'm glad it happens to highly educated doctors too, and not just, the working corporate woman that wants to step out and do something else, because it is fascinating that you were even, those whispers and chatters were happening. I'm not glad, but it is.
It's a
it
universal
how educated
human
you are.
experience.
I mean, we're all hearing it as women. Like you're going to hear the chatter and the water cooler talk and the bullshit, because a woman is becoming bolder and becoming, stepping into who she is as a leader. And I think I praise you for continuing to do it, even when you were called, she must be burned out.
Yeah.
Well, she's a mom now, so she's got to take it easy because she can't balance all of it.
That's what it was at first. And then as time progressed, it's kind of silence.
Well, of course it's silence. Once you see that we take over the world in regards to what we want to do, they're going to stop talking, right?
Yeah. And I'm glad it's gone.
Yeah, I'm glad
really
it's gone
me
too.
off.
Of course it does. So what leadership skills do you have to develop that you weren't necessarily taught in medical school? You were taught none.
Yes.
I was in, when I went to graduate school, it's fascinating how many older attorneys were in my class. And I would ask them.
As a graduate.
My MBA. When I was getting my MBA, I was in a cohort and I had 2 or 3 older attorneys, well over 50, who had been practicing law for over 25 years. And I asked them, why are you getting your MBA? They go, because we're not taught anything about business when we're studying law.
Yeah.
And, all of
so many lawyers have their own practice.
But they don't know about the business side. That's what the ones that I was with, told me, in terms of really watching what can happen in business and having your own practice and what your blind spots are.
Yeah. I'm sure they're there.
Of course.
My blind spots are my blind spots, so I don't know what they are, right?
Yeah. You don't know yet.
I've discovered them. I've obviously made mistakes along the way and learned and restructured. I'll tell you, I'm not the first to do what I'm doing in the country, and there's a very generous community of other direct care physicians out there that have shared their fumbles and their experiences. And when I first opened, I was like trolling all of those groups. I spoke to several physicians across the country that were female physicians that were willing to share their experience. They're like, do it and don't look back.
Yes, do it.
I met with other physicians in Las Vegas that are doing this.
Some in our community that did it.
Yep. That were very generous. Yeah, exactly. That were very generous in helping. And part of the reason why I was like, I want to do this. Look at these. Look how happy and helpful these people are.
And they're so much happier. That's what I find fascinating. They're doing funny reels, inspiring. A weight has been lifted off their shoulders.
I feel like the most authentic version of myself in I can't even remember how long. It is kind of like the whole journey was taking me to this place. It was a roundabout way, but it was the only way. But as far as like skills that I've had to cultivate, at first I would be so nervous when I had to kind of speak with someone directly about why I'm charging this money, why I'm offering it. I would need to go into like a quiet room and be like, no one come in here.
Like, learning new skills, you did it.
Yeah, and now I'll just like pull over on the side of the road and
go over what you need to go over.
So I guess that comes down to marketing myself.
Yeah.
And feeling confident about what I'm doing. At first, you're like, is this needed? Is this helpful? And now it's just like
it's needed. And
as you see it blossom, then that confidence comes.
Yeah. So now you're not just a doctor, you're an entrepreneur. And how has your identity shifted a little bit? Because now you're cultivating all these new skills and a muscle that you're working that you never necessarily didn't have to work before. Going through medical school and going into a hospital setting, you're just taught all of that, how to maneuver. But now you're an entrepreneur, you're a leader, you're a business owner. How has your identity shifted? Because you've elevated quite a lot from who Dr. Suze was maybe practicing medicine five years ago to now.
Yeah, absolutely. I'll tell you the biggest thing, and it's so palpable in my daily life, is when I used to see a challenge, I would feel immediately like defeated, like, oh gosh, another thing. Like, I don't have the energy to kind of deal with this. Yeah. This was my old life. Yeah. And now, now that it's like this confidence and this awareness that any problem that comes,
you can figure it out.
I'll figure it out. And it doesn't keep me up at night anymore. Yeah. And so it's just, it's like a practice in solving problems. Right. And then realizing that there's a solution. Right. And that has kind of trickled to like so many, it's not just in my work life, it's trickled to like so many things where I just have this more like I can do attitude.
Good for you. Yeah. I love that. Yeah. At CWL, we talk a lot about self-advocacy and advocating for ourselves and our teams. But how can parents become better advocates for their children in healthcare settings if they don't have direct access to you today? So if they're sitting in a pediatric office, they know they've got 15 minutes, like what is something they can take away from this conversation that they could be armed with to better advocate for their child? If there's any one thing.
Be intentional about the doctor that you choose.
Okay. And how would they, what are the steps in doing that?
Ask friends and family. Sure. There's Facebook groups like, Las Vegas mother groups, and be intentional about the doctor that you choose. I think one of the biggest, what I hear most about the typical healthcare system is that it's usually like the ancillary staff, like the front desk, like you can't access them. You can't get in anyway. There's so many roadblocks to get in and be there. So sometimes that's aside from who the physician is their office accessible? And when you go for your visit, write down a list of questions.
First.
Write down. I even tell my own families, like, write a list of questions so that you know that they're being, that you can address each one in a timely manner.
That's right. Yes.
Yeah. And because inevitably you'll forget when you leave. Yeah. There's also several things that you can do, because like my area of specialty is that post-birth, like fourth trimester. I take care of kids all the way up to 18, but I feel like a lot of families don't have a good plan for when they don't understand what's going to happen in the hospital or how they can advocate for themselves after delivery. Sometimes our best laid plans go wrong, and it's important to have a A, B, and C plan. But if plan A goes wrong, how can you still have a good experience, and how can you advocate for yourself in the hospital? There's some really important things that you can do for yourself to make sure that you feel in control when you go to have your child.
Right. Smart.
So preparing for that.
Yeah, preparing. So we're going to do some fun rapid fire questions coming from a doctor's perspective. Okay. One thing every parent should stop overthinking. Vaccines. Stop overthinking them. We won't get into the debate.
That's going to be, I don't know.
That's controversial, which is fine for this one. One thing every parent should start doing.
Actually reading, not watching social media reels about it.
Thank you. It's the wild west of the internet, even when it comes to doctors. Yes. And people influencing you who say they're doctors. I mean, read, get educated. That's insane. Okay. One non-negotiable in your daily routine.
Working out.
Yeah, smart. Mine too. Best piece of advice you've ever received becoming an entrepreneur.
Kind of what I've already said, in that there's nothing like, have a can-do attitude. Yeah, you can solve problems. Yeah. And also, my dad told me when I talked to him, and I was like, I think I'm going to do this. And he said, don't be afraid, just do it. And he's a pretty intense person, so he was like, don't be afraid, just do it. Just do it, don't be afraid.
That's right.
And I was like, okay. And now that will kind of like play in the back of my head, I'm like, oh, should I do this? And I'm like,
don't be afraid.
What's stopping me? Is it fear? Yeah.
Yeah.
Don't be afraid. Just do it.
Well, Dr. Suze, this conversation was so powerful. How do people find you?
So
talk to the camera,
my website is www.wildflowerpeds.com, and on there's several buttons that you'll see where you can schedule a meet and greet with me. And so you can choose a date and time that works for you, and it's a 15-minute phone call where you can ask me your questions and see what my practice is all about and help to see if it's a good fit for your family.
Yes, awesome. And everything is linked here on the show and in this, but you're not just practicing medicine, you're reshaping families' experiences with their children and their health. And I can't thank you enough for being on the podcast today.
Thank you. Thanks so much for having me.
I hope you loved this episode as much as I did. For more tips on elevating your leadership, please follow us on Instagram, Collective Women's Leadership, or visit our website, collectivewomensleadership.com. And don't forget to like, comment, and subscribe.